And welcome back. I'm Mabel Jong, and you're watching Day One coverage of the World Healthcare Congress. And in our studio right now, we have Dr. Martin Hickey, who is CEO of New Mexico Health Connections. Welcome, Dr. Hickey.
Glad to be here.
Well, give me a little background on what New Mexico Health Connections is.
New Mexico Health Connections is one of the co-ops that was authorized by the ACA to expand competition in the states. So we're an insurance company, and we're now in our third year, 50,000 strong, still growing and actually doing very well.
And in terms of the 50,000 strong, are the numbers adding up to what you had projected when you first launched a few years ago?
Actually, we're doing better than our initial projections, and now we are diversifying. We were initially meant for the exchange population, but now we're doing large business, small business, what we call TPA or administrative services only, self-insured business.
Okay, and how did you become so successful in your numbers? I would assume were quite conservative, but you've been able to surpass that dramatically.
Yes. Again, growing in areas other than the exchange has been the primary factor. But also in New Mexico, there are a lot of uninsured. And there were about 200,000 people, or are 200,000 people, who are eligible. And about 50,000 have signed up individually for the exchange. And we have about a third of that business.
Okay. And how have you found the insured to be able to use their benefits now? Are they able to access the system in the way that you had wanted it to be accessed?
I think we're all still finding out, both the insured and the insurers, as to how people are using it. And for a lot of people, this is their first experience, so they don't understand a lot of the excuse me, technical details of co-pays, co-insurance, and all of that. So they're learning how to use that in time. They're certainly using the doctors in our network. And it's like anything, brand new. It's going to take some time for people to understand it and use it well and get the best benefit out of it.
Terrific. What is the panel that you will be speaking on?
The panel that I'm on has to do with how do you manage risk in the exchange. Again, this is a very unknown population. It's not simply a commercial population. It's maybe a little Medicaid-like. It's for people who are between 138 and 400% of the poverty level, but also for people above that as well. They don't get any tax benefits, but a lot of individuals who maybe couldn't get insurance in the past because medical underwriting had prohibited them. They had maybe asthma or something wrong with their knee. So now they can get insurance because it's a guaranteed issue. So since this is a new population, how do you set a premium? It's very risky because we just don't have that experience, and every year we're learning something more. And then there are pieces about the regulation and the law, like risk adjustment between insurance companies. Some people get more sick people than another one, moving money from the company that didn't get the sick people over to the company that did. It's a great concept. Really tough to execute and do it fairly and do it well. So we're hoping and working with CMS on how to improve things like that. But again, it leads to great risk for an insurer.
Absolutely. What are some of the takeaways you are leaving with attendees? Certainly bringing about your own experience in New Mexico is extremely valuable.
Right.
What other things are you leaving with attendees?
I think with the attendees, a couple of main points. Because of programs like the Risk Adjuster, which really just aren't working well, very large amounts of money being transferred, very unpredictable, and that's leading to a lot higher prices this next year. So I think that unfortunately people are going to see higher prices in the individual market because of the Risk Adjuster, and also there is an end to reinsurance this year. So I think people are going to be surprised by that.
Okay, thank you, Dr. Hickey. And may I ask also, why do you put this event on your calendar?
Get a great group of people here. We had great dialogue, some disagreements in our session, which is always good, and I think that's how people learn best.
Dr. Hickey, thank you so much for your time today.
Certainly. Pleasure.
And I'm Mabel Jong. Thanks for watching. Much more to come.